Hello everyone, I'm Roderick Vicente, a caregiver student of St. Augustine School of Nursing. Today I am going to perform the Oropharyngeal and Nasopharyngeal suctioning. Suctioning is the aspiration of secretion, often through a rubber or polyethylene catheter connected to suction machine. The purposes are to clear the area of secretion for diagnostic purposes. The equipment that I'm going to use: suction machine, suction catheter, sterile gloves, irrigation, saline or sterile water, large towel, tongue depressor, and face mask. First, we must check for the doctor's suit and order for suctioning. This prevents potential errors for the patient checking identification. Ensure client safety to conceive correct procedure for correct client. Next, we assess the client's respiratory status. We also assess purchase sounds and audible solution during respiration system serves for science and systems of complication, and to know if clients experiences major expiration and exploration or there is length or difficulty in breathing. Next, we will perform hand hygiene. This is to prevent possible infections of microorganisms and prevent possible infections. Organize all needed materials. This is to check the quality of the equipment and to save and delegate our time for suctioning. Identify and explain the procedure to the client. Explanation can reduce anxiety and encourage cooperation with procedure. Lower the side rail. Give access to position the patient. Position the client in a polar's position. If conscious, semi-polar's position. Help prevent the aspiration of secretion. If unconscious, in side-lying position towards you. Side-lying position facilitates drainage of secretion by gravity and prevent aspiration. Place towel or drip on client's chin. This is to protect and prevent contact of secretions to the client. Set up sterile container and open and pour the sterile solution. This strictly needs a aseptic technique to prevent infection. The sterile solution is used to flush catheter after each solution pass. We also open a lubricant and put it on the cover of suction kit. By setting up the suction gauge, you must know the excessive negative pressure, traumatize mucosa, and can induce hypoxia. This ensures the suction is functioning. Thus, we perform tube motion to test the suction apparatus. Higher pressure causes excessive trauma without enhancing secretion. This procedure we put on sterile gloves serves the sterile gloves on your dominant hand for contact with the suction catheter in use. The non-dominant hand with the tubing dominant hand will remain steady. You will use a clean disposable glove on the non-dominant hand to protect yourself from exposure to mucous membrane and spill sputum. Holding suction catheter in stereo-dominant hand. Attach the suction control for tubing or suction source filled in non-sterile, non-duet hand. The non-dominant hand is not sterile, so it will control the suction valve. Dominant hand with the glove sound will manipulate the catheter as it is sterile septic technique strictly maintained to avoid infection. Slide the sterile hand from the contact port to suction catheter tubing. Wrap the tubing partially and round the hand. This is to hold a suction catheter in place and maintain sterility and prevent contamination. Lubricate 3 to 4 inches of the catheter rotating in irrigation solution. Lubrication prevents knee constant trauma when catheter is inserted. Through the mouth, insert the catheter. Be sure the finger is not covering opening of the suction port. Apply suction when inserting catheter can damage mucous membrane through the nose. Insert the catheter into obstruct nostril using a slanted downward motion. Make sure finger is not covering the opening port. This is to remove secretion from the pharynx. A suction catheter is inserted through the nose. Proper placement should be observed to ensure removal secretion, and applying suction when inserting the catheter may cause stromatid mucosa. In the procedure, holding your thumb, the opening in the catheter, apply suction for 5 to 10 seconds to maximum of suction 15 seconds. Limiting the suction time to 10 seconds or less prevents hypoxia. Next, with your catheter slowly while applying suction, rotating the catheter between fingers. This is to minimize invagination of the mucosa into the catheters. Deep inside ports, rotation of catheter ensure all parts are reached. Place the full suction catheter in sterile solution and apply suction for 1 to 2 seconds. This is to prevent contamination into the domain of the cavity. Encourage client to breathe deeply and to cup button section, allowing 20 to 30 seconds interval between each side. Never apply suction more than 3 times. You need something 5 minutes into the cupping, help loosen situation, and may decrease amount of suction necessary, while deep breathing help minimize or prevent hypoxia. Turn off suction source using non-dominant hand to lessen the patient's breath and sound and assist for patient need for repeat suctioning. Give time to allow oxygenation and ventilation prevention or give time to allow oxygenation and ventilation prevention of hypoxia, and to also evaluate the effectiveness of procedure. Disconnect suction catheter from suction tubing. Should be applied only as needed to remove secretion, and this is also facilitate for the next session of suctioning. Pull of pull the cap pull the caps of the stereo glove catheter and glove hand. This contain client segregation inside the gloves to reduce heat transfer of the microorganism. Position the clients for the support to provide comfort and safety, and we must know that accumulated respiratory secretion irritate the mucous membrane and are pleasant for the client.